Do you take common medications like painkillers or antibiotics? What if I told you that these medications might be silently destroying your liver without you even realizing it? Think that's an exaggeration? Then listen to this story. Pedro, a healthy 38-year-old man, had never experienced serious health problems. Whenever he had a headache or fever, he took a painkiller. For inflammation, he used anti-inflammatory drugs. And for simple infections, his doctor prescribed antibiotics. Sounds normal, right? Until one day, without warning, Pedro started feeling an inexplicable fatigue. He lost his appetite. His face and eyes turned yellow. The diagnosis? Acute liver failure, caused by frequent use of so-called harmless medications. In less than a month, his liver was so damaged that he had to be placed on the transplant waiting list. And the worst part? This could have been prevented. What happened to Pedro might be happening to you right now, without you noticing. And by the end of this video, I'll reveal a fatal mistake that 90% of people make when taking medication. One that could mean the difference between a healthy liver and irreversible disease. Stay with me, because your health might depend on it. The liver is one of the most incredible organs in the human body. It filters toxins, regulates hormones, and metabolizes everything we ingest, including medications. But here's the problem. Most people don't realize that certain medications can be toxic to the liver, even when taken correctly. And we're not talking about illegal drugs or heavy substances. We're talking about common medications, available at any pharmacy. Quick scientific facts to establish credibility. Drug-induced liver injury accounts for 5% of hospital admissions and 50% of acute liver failure cases. Acetaminophen, or paracetamol alone, is the leading cause of liver toxicity in the U.S. anti-inflammatory drugs, and antibiotics can overload the liver over time, making it harder for it to regenerate. And do you know what's even scarier? Symptoms only appear when the liver is already severely compromised. If you're experiencing unexplained fatigue, nausea, pain on the right side of your abdomen, or changes in the color of your urine and stool, this could be a warning sign. But don't worry. In today's video, you'll discover which medications are the most dangerous for your liver, how to identify the early signs of liver damage, and most importantly, how to protect your liver without giving up necessary treatments. And stay with me until the end, because the last mistake is the most dangerous, and almost no one talks about it. Hidden signs that your liver is overloaded by medication use. Your liver doesn't send warning signals until it's already suffering, and if you take medications regularly, you might be damaging your liver without even realizing it. But here's the good news. There are warning signs that indicate your liver is overloaded from medication use. You just need to know what to look for. Here are the 5 most common signs that your medications may be harming your liver. Sign number 1, chronic fatigue and weakness. Do you feel tired all the time, even after a full night's sleep? This happens because an overworked liver can't process nutrients efficiently, leading to constant energy depletion. This is especially common in people who take high doses of acetaminophen, Tylenol, or cholesterol-lowering statins. Have you been feeling more tired lately? Drop a comment below. Sign number 2, nausea, vomiting, and loss of appetite. Many people think nausea is just a stomach issue, but in reality, it's one of the first signs of drug-induced liver injury. Example, the FDA has issued warnings that antibiotics like amoxicillin clavulanate and tetracyclines can cause nausea and appetite loss due to liver stress. Sign number 3, dark urine and pale stools. Your urine should be light yellow and your stool should be brown. But if you notice dark, cola-colored urine or pale, whitish stools, this could mean your liver is struggling to process bile, a common side effect of birth control pills and steroids. Sign number 4, itchy skin, pruritus. Without a rash, if your skin constantly itches but there's no visible irritation, this could be a sign of cholestasis, a condition where bile builds up in the liver due to medication overload. Example, Cholestasis is a well-documented side effect of certain antibiotics and anti-inflammatory drugs, such as ibuprofen and naproxen. Sign number 5. Jaundice, yellowing of the skin and eyes. This is the most obvious sign of liver damage. If your skin or the whites of your eyes turn yellow, seek medical help immediately. Real case. In the US, a 23-year-old college student developed jaundice and acute liver failure after taking high doses of acetaminophen, Tylenol, for chronic headaches. She needed an emergency liver transplant. If you've experienced 2 or more of these symptoms, your liver could be at risk, but don't worry. Next, I'll reveal the 5 most dangerous medications for your liver and how to protect yourself before it's too late. The 5 most dangerous medications for your liver. You don't have to be an alcoholic to suffer liver damage. Many people who develop liver disease have never had a drink in their lives. They just took everyday medications without knowing the risks. Here are the 5 most toxic medications for your liver. 1. Acetaminophen, Tylenol, paracetamol. The silent killer. Acetaminophen is found in over 600 medications in the US, from pain relievers to cold and flu remedies, but it's also the leading cause of acute liver failure in the country. Scientific fact: the FDA reports that taking more than 4,000 milligrams of acetaminophen per day, which can easily happen if you take multiple medications, can cause fatal liver damage. Tip: never mix Tylenol with alcohol or take it for more than a few consecutive days without medical supervision. 2. Antibiotics. Amoxicillin, clavulanate, tetracyclines, erythromycin. Antibiotics are essential in many cases, but excessive use can cause inflammation and severe liver damage. Study case. A study by the National Institutes of Health found that amoxicillin clavulanate accounts for over 20% of all drug-induced liver injuries in the U.S. Tip: always take probiotics and eat liver-friendly foods when using antibiotics to minimize damage. 3. Anti-inflammatory drugs. Ibuprofen, naproxen, diclofenac. The hidden threat. These over-the-counter painkillers are widely used, but they increase the risk of drug-induced hepatitis and liver failure. Example: in 2020, a patient in the US developed severe liver inflammation after taking ibuprofen daily for back pain. Doctors confirmed the medication was the cause. 4. Birth control pills and hormone therapy. Oral contraceptives and hormone replacement therapy can increase the risk of liver disease by affecting bile flow. FDA warning: some forms of birth control have been linked to liver adenomas, benign but potentially dangerous liver tumors. Tip: if you use long-term hormone therapy, ask your doctor to check your liver enzymes every 6 months. 5. Chemotherapy drugs and antidepressants. These medications are metabolized by the liver and can cause permanent damage if not properly monitored. Example: the chemotherapy drug methotrexate has been proven to cause liver fibrosis, scarring, with prolonged use. Are you taking any of these medications? If so, don't panic, but you need to know how to protect your liver before it's too late. Coming up next, I'll show you 5 simple ways to protect your liver and keep it healthy, even if you need to take medication daily. How to protect your liver, even while taking medications. 11:30, 14:30 Balasmantius. Now that you know which medications can destroy your liver, the big question is, how can you protect yourself without giving up the medications you need? Fortunately, there are 5 proven strategies to prevent liver damage, even if you take medications regularly. Let's get to them. 1. Avoid self-medication at all costs. Have you noticed that in the United States, many medications can be purchased without a prescription? And that's a big problem. Our brains have been conditioned to believe that if a drug is available for purchase, it must be safe. But the truth is, continuous use without medical necessity can be fatal for your liver. Famous case. In 2007, actress Brittany Murphy started taking pain and cold medications without a prescription. After months of continuous use, she developed severe pneumonia and liver failure. Shortly after, she passed away at age 32. 2. Get regular liver function tests. If you take painkillers, antibiotics, hormones, or antidepressants, Ask your doctor for a liver enzyme test every 6 months. Scientific fact: the American Liver Foundation recommends that people on long-term medications undergo regular liver function tests, as 80% of liver failure cases could be prevented with early diagnosis. Drink plenty of water, but the right way. Water helps the liver eliminate toxins, but chugging it all at once won't help. Tip: the ideal approach is to drink at least 2 liters throughout the day and never drink large amounts of water while taking medication, as this can dilute digestive enzymes and affect absorption. Eat foods that protect your liver. The liver can regenerate, but it needs the right nutrients to do so. The second video in our series is dedicated to this topic, and if you haven't seen it yet, I'll leave the link in the description. But for now, here are some of the best foods to protect your liver from medication damage. Avocado helps the liver eliminate toxins. Lemon and apple cider vinegar stimulate bile production. Milk thistle, one of the best natural liver protectors. Interesting scientific fact: researchers from the University of Maryland discovered that milk thistle can reduce liver damage from medications like acetaminophen by up to 50%. 5. Never mix medications with alcohol. Have you ever noticed those warnings on medication labels that say, "Do not mix with alcohol"? They're not there for nothing. Both alcohol and medications are processed by the liver, and mixing them can be like pouring gasoline on a fire. Famous case: actor Heath Ledger, famous for playing the Joker, died at age 28 after an accidental overdose of medications. His liver couldn't process everything at once, leading to multiple organ failure. If you follow these 5 strategies, you can continue taking your medications without putting your liver at risk. But now comes the most important part. There's a simple way to test if your liver is already overloaded, and you can do it at home. I'll show you how next. At-home test to check if your liver is overloaded. Want to know if your liver is already overloaded from medication use? Here's a simple and effective test you can do at home. Test 1. The morning urine test. How to do it: when you wake up, check the color of your urine. If it's light yellow or clear, your liver is working well. If it's dark, like tea or cola, this could be a sign that your liver isn't eliminating toxins properly. Test 2. The bitterness. Test how to do it. Take a piece of arugula, chicory, or lemon peel and chew it for 10 seconds. If you feel a very bitter taste, your liver is functioning normally. If the bitterness is weak or non-existent, your liver might be overloaded and producing low levels of bile. Test 3. See the white eye test. How to do it: stand in a well-lit area and look in the mirror. If the whites of your eyes appear slightly yellow, this could indicate a buildup of toxins in the liver. If you notice changes in any of these tests, it could be a sign that your liver is already suffering from the effects of medications. Now that you know this, what should you do? In the next episode, I'll show you a crucial factor for liver regeneration, one that 90% of people ignore. So, like this video, subscribe to the channel, and turn on notifications so you don't miss out, because we're not done yet. I have even more important information for you. Powerful conclusion. Now you know, common medications may be silently destroying your liver, and most of the time, we only realize it when it's too late. But the good news is that you can take action now to prevent irreversible damage. Quick recap of the strategies we covered. Avoid self-medication, because unnecessary use can poison your liver. Get regular liver tests to detect problems before it's too late. Drink water properly and eat liver-friendly foods to help your liver eliminate toxins. Never mix medications with alcohol. This combination can be fatal. Try the at-home tests I taught you to assess whether your liver is already overloaded. But there's one final, very important detail. Many people try to protect their liver only through diet, but they ignore a crucial factor: sleep. And in the next video, I'll show you how sleep directly impacts liver regeneration and the mistake that 90% of people make before going to bed. So, like this video, subscribe to the channel, and turn on notifications so you don't miss this crucial information. Scientific references. All this information is not just speculation. It's based on scientific studies and renowned experts. Dr. Sanjay Gupta, neurosurgeon and CNN health journalist, USA. Acetaminophen toxicity is a growing problem in the U.S. The safe limit is 4,000 mmol per day, but many people exceed this dose by combining different medications without realizing it. Source: CNN Health, FDA, Food and Drug Administration, USA. Acetaminophen is the leading cause of liver failure in the United States, resulting in thousands of hospitalizations and even liver transplants each year. Source: FDA Gov, National Institutes of Health, NIH, USA. Antibiotics account for 20% of drug-induced liver injuries in the U.S., with amoxicillin clavulanate being a major culprit. Source: NIH Gov, Dr. Andrew Huberman, neuroscientist at Stanford University, USA. The liver follows a regeneration cycle that is directly dependent on sleep. People who sleep less than 6 hours per night have up to a 40% higher risk of developing liver problems. Source: Huberman Lab. If you want to check out more details about these studies, the links are in the video description. See you in the next video.